Hello and welcome to Wellness Wednesdays. I'm Dr. Stephen Ramos, Associate Medical Director with HealthTexas Primary Care Doctors. And every week we're going to bring you a video with special guests discussing important health topics. All right, well, we're back again on Wellness Wednesday. Today I have Kimberly Rodriguez here with me today, agency owner of Coverage to Care. Kimberly, thank you for joining me. And so, Kimberly, you own a agency that helps people kind of find health insurance very specifically. Is that correct?
That's correct.
Okay. Tell me what kind of products or what kind of things that you reach out to the San Antonio community and help them out with.
So primarily we focus on those that are Medicare eligible. Primarily it's the age of 65 and older. Sometimes we will find some people under the age of 65 also qualifying for Medicare, just depending on if they have been deemed disabled for 24 months or longer, if they have diagnosis of ALS, also known as Lou Gehrig's disease, or if they have end-stage renal disease. So there is a possibility that somebody under the age of 65 can be on Medicare as well.
Okay. So if we have individuals out there listening who are eligible, mainly probably the 65 and older, what's the importance of reaching out to someone like you if they're trying to discover and look into different Medicare options?
Great question. I think one of the biggest things is confusion. There's lots of confusion. A lot of people have this misunderstanding that once they become of retirement age that they're going to be able to come onto Medicare and pretty much just have the coverage needed because they've worked and paid into those Medicare taxes. Unfortunately, original Medicare is just the start of their coverage after retirement. And so it's very important to meet with an agent, but not just a licensed agent, but also a local licensed agent. Meeting with the local licensed agent will give the opportunity for that agent to not just be knowledgeable of what's available in your area and what's going to fit your needs both financially and medically, but also to ensure that your medical group, your home, your doctor is something that is going to be incorporated into the plan that you choose for that coverage.
Great. So just a lot of information, local knowledge, I guess, is kind of the best way to put it. So what separates Coverage to Care from maybe some other agencies in San Antonio?
So I'll say that with Coverage to Care, we are all about education. We definitely want to make sure that we explain the original Medicare program first, and there's no real way to add on additional coverage without having a base, a foundation to what that coverage consists of. And so with Coverage to Care, we are all about that education process first. And then, of course, we are also available for lifetime on claims and service. And that's huge because a lot of the times the biggest concern or chief complaint that we get from Medicare eligibles is that they come into a program, they get coverage from an agent, they are not local, they don't have a phone number to reach out to them, and then they're pretty much gone after the signature.
Yeah. Well, I mean, that's great. And it's a great resource for our city to be able to help, help a lot of our population and a lot of our patients really kind of select the right thing for them. And I think what you hit on most is making sure that they, have a doctor or a medical group that has a lot of experience with Medicare and so forth. And so can help get them connected and make sure that they're doing well. And then we'll put some links in the information for the podcast today on how to reach out to Coverage to Care. If you do have questions or are looking for an agency, or maybe you never really thought you needed the help, you can always reach out to Kimberly through the links below. So one thing I want to talk to you about, so star ratings for CMS and for Medicare plans. Can you describe a little bit of what that is and why that's important? Why should people be looking out for star ratings?
Yeah, great question. 5-star rating is something you definitely want to pay attention to. This is a graded system. This is something that every individual insurance company, private carrier that offers coverage is being graded by CMS, Centers for Medicare and Medicaid Services. And so when they have this graded system in place, it's really keeping the insurance companies on their toes. They definitely look at all different types of things from quality measures to customer service to claims processes. And it really even very much so depends upon how you're treated at the doctor's office, from the doctor all the way down to how you're greeted when you come into the clinic.
Okay. So from a star rating, is it like 1 to 5, 5 being the best, 1 being maybe not so best?
Yeah. So 1, poor stars. 5 excellent stars. So to have a 5-star rated plan is beyond excellent. It's a phenomenal opportunity because then you know that the insurance company is working for you. So a 5-star rating is definitely very, very unique. And it is something that we are excited to say that there is a carrier here in town that's offering that for 2022.
So who is that carrier for 2022?
The AARP UnitedHealth Medicare Advantage plan.
Okay. And I believe this is the second or third time that they've achieved that 5-star rating in the last few years. So that pretty common? Do we see a lot of 5 stars?
You don't really see a lot of 5 stars. And to be able to see that is something that, like I said earlier, is pretty phenomenal. To find something with a 5-star rated plan definitely helps you feel that comfort of knowing that your insurance company is really working for you as an individual.
So not only reaching out to Kimberly to kind of talk about which plans are right for you, but also, Medicare themselves has a way of kind of guiding some patients to pick that, I guess, better insurance coverage for all around benefits, huh?
Yeah, so I'll definitely say as an individual agency, we really pride ourselves on that education. It's very important to note that we create this needs analysis for each individual person. So we're actually looking at, like I mentioned earlier, that medical and that financial need. We're going over doctors they're seeing, medications they're taking. And a lot of the times we actually even encounter patients or clients that don't have a primary care physician that are looking. I will definitely say a lot of the times we see those that are either English speaking or are bilingual Spanish speaking clients that really do feel underserved. So we do have a team of 85 agents in San Antonio and the surrounding markets, bilingual. So definitely we have the ability, not just with material, but also the language, right? It's very hard when you don't speak the language to be able to understand it. So we really do create this core of education and understanding of opportunity.
Great. And so getting into Medicare, changing a plan, or maybe you don't have a kind of private insurance with the Medicare and looking to do that. Right now we've had some others on and talked about the annual enrollment period going on basically right now. But are there any other times during the year or other circumstances where somebody can say, you know what, I'm not pleased with the current plan that I have. Can I change to another one?
Absolutely. And I'll say that when we look at the annual enrollment period from October 15th through December 7th, that's the primary enrollment that a lot of people know of. Lots of the time when you see mailers and phone calls and advertisement coming through on TVs. So I'll say that you definitely have another window of time, which is January 1 through March 31st. That's known as the open enrollment period. And I'll give you an example. If you have somebody that, whether they made a choice in annual enrollment from October to December, or maybe they didn't, and they've just stayed on their plan, they missed that window. If they're already on a Medicare Advantage plan, they can actually switch to another Medicare Advantage plan during that enrollment from January to the end of March. So let's say that you're on a Amerigroup and you're looking to come over to UnitedHealthcare. That's an opportunity that you can do so within that window of time. Now, I will say, kind of just tying in the conversation of that 5-star rating, we're super excited to announce that because of that 5-star rating, it gives you the opportunity all year long, not just in that January through March window, to make a change. So if you've missed October through December or January through March, don't worry. Know that you can still come and reach us and talk to us, and we can still do something for you between April and the end of the year.
Okay, great. So a lot of options out there, especially for San Antonio. And I guess that 5-star rating really is important to our city because it does offer a little bit more flexibility for people to move around if they need to.
Correct.
Great.
Absolutely.
And so what about anything new that you foresee coming in 2022 as far as coverage and Medicare coverage for San Antonio?
I'll say that I'm definitely impressed with what we have seen from these private carriers, from specifically with UnitedHealthcare, that has gone above and beyond, offering so much more than just what's the immediate care that's tied into the health side. We definitely see grocery cards that have come into play, where it offers you a certain amount of coverage for the healthy eating of grocery that you're doing every single month, all the way to over-the-counter catalog benefits, where you're able to get non-prescribed everyday use items like raised toilet seats, compression socks, toothbrush, toothpaste, vitamins. There's so much offered through these catalogs, and it's a use it or lose it credit. So this is something that you definitely can take advantage of, and all you have to have is that Medicare Part A and the Part B component to qualify for this UnitedHealthcare Advantage plan.
Yeah, those benefits are really, really important. I mean, we utilize them a lot, from as little as getting a blood pressure machine every year for our patients, being able to monitor a couple things at home that, otherwise we wouldn't have been able to. And, some of my patients just can't afford that $30, $50, whatever it may be, to just have a blood pressure machine. Like you said, I think the bedside commodes and a lot of just kind of simple things that we kind of overlook, continue to offer very good benefits. So any other big changes or any other kind of added benefits you're going to see this year that maybe we didn't have in 2021 or before?
I will say that we are seeing, or we're anticipating for the deductibles for Part A and Part B on that original Medicare platform increase. We're also seeing that Part B premium potentially increase. We don't exactly know what those figures to be yet. Speaking with a local agent under our agency is a great opportunity to make sure that we actually create that needs analysis, because we actually look at income. We look at assets. There's a lot of people out there that don't even realize there's an opportunity for coverage with Medicaid. The Texas Medicaid program is something that's offered to those that fall under a specific income and asset level. But let me tie in one of those advertisements that we see all the time on TV that says, call now, you get the $148.50 back into your Medicare check, and you've got to be in a certain zip code. I bring that up because of the fact that we've gotten a numerous amount of calls in reference to this ad. And unfortunately, it's an out-of-state call center. They're trying to get you to just call. A lot of the times they know you're not going to qualify if you're not under that income or asset level. And then once they have you on the phone, it's a matter of just going over your doctors, your medications, and then they switch you to a different plan. And we've gotten so many clients calling so frustrated because they try to go see their doctor and their plan has changed.
Yep. Yeah, we see that a lot. And so what I tell all of my patients who are, on a plan and we can see that things are going well and, they don't necessarily have any concerns. During this time, I got to tell them, look, if you get a phone call or a letter in the mail, read through it, but talk to your agent, talk to anybody you can to make sure you're making the right move. And, because unfortunately we have seen that where, somebody has no idea that they switched their plans and they come in and try to see us and, well, we got to do some work.
Yeah.
But, so always a good tool and resource to have. Like you said, education, I think that's fantastic. So people really know what benefits they're getting and how to really utilize and have their insurance work for them rather than just kind of waiting for things to happen and hoping my insurance covers this and that. Being able to walk in and know exactly what you have and what's going to be covered and all the benefits is just tremendously important.
I will also mention that UnitedHealth is creating another HMO plan available for 2022 that mirrors a very popular plan available now, labeled under the Secure Horizons. That's something else to make sure that you're talking with a trusted local agent. You could be talking with a call center and you think there's no harm because you're under the same umbrella, but then you get switched through your primary care physician. So it is imperative that you do talk with a local licensed agent, and again, a trusted agent, because they can ensure to give you those differences. And if it's something that makes sense, then it would be a great opportunity but also to keep you with your primary care physician.
Yeah, we try really hard to develop really good relationships with our patients. And so that's part of why you want to stay with a primary care doctor that you trust and that you ensure that you have a good experience with. But the other thing is, some groups like for HealthTexas, we have been navigating that United AARP program for a long time as far as what's in network, where to go when you need radiology, treatments, which hospitals. We know what we're doing. And we can really help our patients navigate through that so that they don't really have to do the guesswork. But if they get switched to a different plan and say, well, okay, fine, I'll go to a different primary care office, and they don't have that expertise that we have, and they're going to be lost in the wind, or they're going to go see a specialist that's not covered, and now all of a sudden they have this huge bill. So it is pretty important to make sure that you're with a primary care group or primary care doctor that understands your plan and understands the benefits and how to navigate that. So
yeah, and I'll say to that note of huge bill that can come about, it's something that when we sit down and we talk with our clients, we really go into great detail. A lot of the times people think that it's such a great avenue to be able to, even under the Medicare Advantage umbrella, to look at something else like PPO. What people don't understand with the PPO policy is, yes, it gives you that flexibility, but does it really, because of the fact that you actually don't have that primary care physician involved? And because of that, if you happen to go to a doctor that is out of network, that's more cost out of your pocket. These doctors' offices are not asking you if they're in network or not. So somebody like HealthTexas is definitely helping manage and go through that process as far as who you're going to go see on the specialty side, and then ensure that that specialist is actually referring back to you on what happened, what medications are being taken. And a lot of what we see of those increased hospitalization stays is because of that interaction of medication sometimes.
Yeah, more is not always better for a lot of times, and making sure that for when I send out to a specialist or for extra testing and what have you, I know that I'm going to get that response back. I know that the person that I'm sending to X, Y, and Z specialist, whether it's a cardiologist, orthopedic surgeon, what have you, I know them. I've used them many times before. I trust in their expertise, so they're going to take care of my patient. Whereas with some other, patients of mine who kind of just go and they pick and choose on their own, I'm kind of out of the loop, and there's not much I can do to help in that time. So making sure you're in a good network and making sure that everybody's kind of familiar with what's going on is just tremendously important. And some people overlook that.
Absolutely. Absolutely. I know one of the other discussions that is a hot topic is dental coverage, and looking for coverage that not only is going to give you a little bit more of that allowance on the comprehensive side for that tooth being pulled or the root canal or the implant, but also going to another extent to saying, well, can I have access to this full allowance without having to pay a cost share, a co-insurance? And that's a hot topic. Even if it's just 50% of a tooth being pulled, and let's just say it's $200, $100 is a lot of money for somebody on retirement. So, I can definitely say that UnitedHealthcare is offering a program like that offers you that opportunity to that full allowance without having to meet a cost share.
Yeah. So the more information you can have, the better. The more education you have, the more you understand your insurance and your benefits. I think you're going to be healthier. You're going to be happier. Navigating the whole healthcare community is just going to be easier.
Yeah.
So, well, I really appreciate you kind of sharing this information with us, and hopefully we got a good amount of education out to everyone listening here today. Again, pleasure having you on with us, and look forward to continuing working with you.
Same. Thank you so much, Dr. Ramos.
All right, everybody have a good day.
Bye.
Thank you for joining us for Wellness Wednesday. Again, I'm Dr. Stephen Ramos with HealthTexas Primary Care Doctors. If you have any questions or want to reach out to us, our phone number is 210-731-4800, or you can visit us on our website at healthtexas.org.